And so these pharmacy benefit managers, they'll have what are called formularies. They're lists of drugs that are covered or not covered, and they steer people into the different drugs that they get paid higher rebates on. So maybe you've heard of rebates, maybe you haven't, but a rebate is basically just a kickback on higher cost drugs, usually specialty drugs. And so those rebates are paid back to the fully insured plan. They're not paid to the employer. On a self-funded plan, those rebates come back to the plan to help offset future costs. So that's one major difference between an independent pharmacy benefit manager, one that's not owned by one of the large insurance companies, and the three that I talked about.
Gentry, welcome to the podcast, man. Thanks for coming on.
Great to be here, man.
You were standing in the wrong place at the right time, or the right place at the wrong time, because you were standing next to me at the APTA PPS conference, and I'm super shy, and I'll just start conversations with anybody, and I'm like, hey, man, where are you? I think I was like, where are you a PT? And you're like, well, I'm not. I'm like, okay, cool. Then why are you here? That's interesting. So how do you typically explain if someone like me were to ask you, like, what do you do, or where are you a PT? You're like, I'm not. What do you do?
Yeah, after 20 years, I've had a lot of time to think of the answer to that question, Jimmy. So typically I tell people, and they're a little shocked by this, I think some of them, maybe not so much the PTs, but I just tell them I help people get away from the big bad insurance companies that, in my opinion, have destroyed our healthcare system. And obviously that causes a lot of curiosity, but that's my common answer now is, in the past, there weren't a lot of options, and I think there are more and more options becoming available.
All right, that's what you do, but how do you do that? How do you help people get away from the big bad insurance company? Now we'll zoom in just a little bit.
Yeah, for sure. So depending on the size of the group, right, it's harder when you don't have as many employees, but when you have around 100 or more employees, it opens up options to use third-party administrators that can adjudicate claims. You can really tailor your plan. You can get stop-loss insurance to protect your company. You can choose a pharmacy benefit manager that's not one of the big three that's owned by the insurance companies or vice versa. So that's what I do is I create tailor-made solutions when it comes to health plans.
So if you're a clinic or a group of clinics with 100, we'll just draw a line at 100, imaginary line at 100 or more, you get to now you can come in and create or sort of get to start to choose your own adventure health plan for that organization?
Yeah, that's right. So we've had 3 this year alone. One of my clients, Tim Spooner, a lot of people know him. He's kind of a pioneer here in Phoenix, Scottsdale area. He referred me to kind of his group, right? His practice group of, different business owners across the country. And so we're fortunate to work with several of them this year. And we moved them from a fully insured plan to a self-funded plan. 2 of them are in California, one up in Washington State, and we just finished up another one in Pennsylvania. So it's not state specific. We're licensed in all 50 states, can work, with anybody. So
that's cool. All right. So what problems does this alleviate? I'm guessing cost is, if you talk cost, you got people's attention. But what other doors does it open? So I'm guessing, I don't want to put words in your mouth, but I'm guessing it reduces cost, or at least to maybe make risk a little bit lower. What else? Like, what are the things on the benefit side of doing this? What would you call this? Self-funded insurance for your company, for your organization?
Exactly. So it's self-funded insurance, but you can go to a self-funded plan through what we call a BUCA, right? I'm going to use that term: Blue Cross, United, Cigna. Now, those are the big insurance companies across the country. But obviously, it does reduce cost. Usually, health insurance is the second or third highest line item on a company's P&L, and this helps, reduce that overall cost. It also improves the quality. There's a misconception in our country, unfortunately, that if I pay more, the quality is higher.
Right.
And in health insurance, it's actually the inverse of that. It's
right.
The surgeons that do something more are better at it. And so they can charge less versus charging more. Now, where the cost comes in is these hospital systems, they like to refer to their surgeons, and a surgery inside a hospital setting is much more expensive than a surgery in a ambulatory surgical center. So that's one of the benefits, and the quality is significantly higher. So not only does it reduce the cost, but it also improves the quality for the patients, and the members on the health plan.
All right. So pros and cons of each approach. Let's just go make sure we'll stay with the basics before we go deeper. So the difference is the difference are fully insured plans. Am I safe to call them like the typical plans,
That's
right? Fully
correct.
insured plans
Yes.
versus self-funded. Let's just do pros and cons. Give them the quick high level, because if someone really wants to dig into this, they're going to call you and we'll put your information on there and we'll share that. But do pros and cons of each.
Yeah, so let's start with the cons first. The cons of a fully insured plan is you're subject to whatever the carrier gives you, right? In terms of your plan design,
Right.
deductibles, copays, out of pocket. You can't do anything innovative within a fully insured plan. It is what it is. We call them shelf plans, right? They're filed with the state, they're mandated, they have all of the different requirements, right? So that's a huge con. Another huge con of fully insured is you get no reporting at all. So
Wait, no,
you
what? Say
you
that again.
get no reporting of data of where your money is going. How is my money
Oh,
being spent by the members on my plan? I get zero data. Now, with 100 or more employees, you get limited data, but you don't get full access to the data or the reporting in a fully insured plan. So
why
that's
would that be
another
important?
con.
Why is understanding that with what like, so the business owner you're talking about, the person who's funding the health insurance, why would you want that information, and then why can't we get it?
So in every other aspect of business, a business owner has access to how things are where costs are going.
Sure.
And if you don't know where costs are going, you can't control a cost. And so I think it's on purpose. I'm not going to go into conspiracy theories or anything like that, but um, you don't get reporting, and they hide behind HIPAA. The insurance companies say, well, if you have 100 employees, you could identify people and be discriminatory against them. That's not
Oh.
correct. That's not true. So a big downfall of a fully insured plan is you get very limited reporting, and because of that, you can't control where your dollars are being spent and the quality of it either. So
Yeah, I mean, you mentioned that inverse proportion is we hear that every once in a while. We definitely hear it every 4 years in terms of the U.S. is the biggest spender in
yeah,
healthcare, and we're 30th on the list in this, and 42nd
that's
and
right.
53rd. So that's definitely true. All right, so that's number one con: blind. I have no idea where this money is going. I just keep throwing money into a
Yep,
hole. I don't know how it's being spent, and then magically next year or the next time my contract is up, it costs more, and maybe I'm offered less.
that's correct. So let me just give you one example of one of the plans that we worked with this year. We had an employee that was on a very high prescription drug. We would have never gotten this information from their fully insured carrier up in Washington State. And this individual, we were able to assist them to get this drug sourced internationally from Canada, right, north of
Across
Washington
the
State.
border.
And they were paying the plan, meaning the overall cost for this drug was around $6,000 a month. And we were able to get it through an independent pharmacy benefit manager who works with a Canadian pharmacy for roughly $1,500 a month. So a significant difference, right? By just going and being innovative, getting the same drug, it's shipped to the employee. There's no member disruption, so it's very simple. There are lots of little levers and buttons to push within a self-funded health plan that you cannot do within a fully insured
Well,
plan.
you couldn't do it, but there's no reason for the fully insured plan to even look into that, right? There's no reason.
Well, that's right. Claims equal premium. So the higher the claims are, right, the higher the premium that the insurance company can charge. And so there isn't any incentive. And you have stockholders, shareholders that, they have to increase their pricing in order to look better on their earnings. So there really isn't any incentive versus a self-funded plan. The employer has every incentive to control the costs without disrupting the members, right? Or at least working with the members to try to find other solutions and say, this health plan is our health plan. The better we utilize the plan, the better we, save money by getting drugs outside of the country if we can. That directly competes with your W-2 income. So if we're more wise with the way that we spend our current dollars, we can offer better benefits and we can reduce the costs that we charge to you.
Physical therapists, if you're not up on blood flow restriction training, you're missing out. BFR, it's the future of rehab. Owens Recovery Science has the certification for learning BFR from the ground up. You'll get hands-on with the best tech, expert insights, and tools to deliver real results for your patients. Stop waiting. Check out owensrecoveryscience.com. That is owensrecoveryscience.com, and get certified in BFR today. Physical therapists, if you're ready to stop playing small and actually master your specialty, Brooks Institute of Higher Learning is where it's at. Imagine one-on-one mentoring, hands-on labs, top-tier facility, all while earning a full salary and benefits at Brooks Rehabilitation. We're talking 8 cutting-edge residencies, specialized fellowships, and a 93% board pass rate for graduates. Get trained by the best with the best. Check out brooksihl.org. That's brooksihl.org, and start leveling up your career today. All right, so you threw out a few pros and cons. What else jumps to mind, or what else do you typically? I always ask what passes the eyebrow test. What, when Gentry mentions it, makes like a practice owner go, "Ooh, okay, didn't think about that."
Yeah, well, obviously the cost. We do an analysis, right, for everybody that we start working with or want to, start working with us, and we look at the overall, benefits. Typically, the first year we don't change the benefits at all because we want to be able to gather that data within the first year, year and a half. So then we can really start looking at, are deductibles appropriate? Our copays, our out of pocket? What other solutions can we be looking at? For example, diabetes. There are lots of different diabetes programs and vendors out there that can drastically reduce the costs and improve the health of employees. And so those are the things that we're looking at. It's really a strategy of, we have the data, now we can start creating the plan based on your employee population. And the great thing about these private practice groups are most of these employees are young, they're out of school, they're starting their families, and they're healthy. And so why be pooled with sicker risks when you've got an employee population that's much healthier than the general population in our country?
There's another acronym. We can't get too many acronyms in healthcare. Can't get enough of them. TPAs, third-party administrators.
Administrator.
You've
Yes.
said they can be a key alternative to these traditional insurance companies. What are they? How do they operate? How do they operate differently? And what advantages can this third-party administrator offer a business owner?
Yeah, great question. So I like to think of a third party administrator as the quarterback to the plan. So think about like an insurance company, customer service, ID cards, adjudicating claims. Sorry, they're the ones that basically are running the plan and are the kind of the front forward facing of to the employees. But
Right.
it's extremely important because they're the ones that implement the stop loss insurance and the pharmacy benefit manager and the medical management. And so it's really key that you have a team of people on the third party administrator front that understand what the plan is trying to accomplish. And kind of the Bible to the plan is what we call the summary plan document, right? It's the Bible to the plan. It says for every little thing what's covered and what's not covered and how
Right.
things will be paid. And so you've got your network, you've got your pharmacy benefit manager, stop loss, medical management. The TPA is the one that's in charge of managing and coordinating all of those different pieces, because what most people don't know, in your Blue Cross plan or your United plan, you have all of those different players right now. You just never see them, right? With a third party administrator and an unbundled self funded plan, meaning completely independent of any insurance company out there, you get to see how all of those different pieces function, and you get to choose best in class. Right now, we have a very limited market when it
Sure.
comes to fully insured. Maybe in any state, you have 4 or 5 players. I can go out to 25 or 30 different stop loss carriers. There are hundreds of pharmacy benefit managers. So you're really opening up your field to other options instead of just 4 or 5.
Okay. More acronyms, more letters. We went
Yes.
from TPAs to PBMs. Those are
Yes.
pharmacy benefit managers. You just talked about an example of changing a
Mhm.
cost from $6,000 a month for one employee to 15, right? So pharmacy
Mhm.
benefit managers and stop loss protection, which you'll have to explain to
Yes.
me a little bit. Talk to me like I'm an idiot because this is a little out of my comfort zone, but I want to learn it. So PBMs and stop loss protection play crucial roles in controlling costs. Walk us through what those things are, how those elements work together, and where business owners can go wrong and right with their strategy.
Yeah, so let's start first with stop loss insurance. So there are two different types of stop loss insurance. You have specific and you have aggregate. Specific is insurance on any one individual that has a catastrophic claim, like cancer, heart condition, serious back fusion, right? These high preemie babies, those are examples of a catastrophic claim on any one employee, or it could be a spouse or a child. And so you buy specific stop loss insurance to protect the business, the plan, from any one individual bankrupting the plan. So we use the specific stop loss to cover any one individual. And then we have aggregate or umbrella insurance in the case that we have lots of claims, just lots of claims from multiple individuals. So you're covering yourself from one individual and you're covering yourself as a whole using the aggregate insurance. Now, the insurance companies, when you get your renewal from a fully insured carrier, they increase your renewal on everything, right? Your the administration of the plan, pharmacy benefits, medical management. On a self-funded plan, your renewal is usually just on your stop loss. There may be some minor increases to the other pieces of the plan, but you're not getting a 10 or 15% increase on the full premium that you're paying. It's typically on just the stop loss. And you're also paying taxes, right, on your full premium. With a self funded plan, you're just paying the taxes on the insurance premium for the stop loss insurance. So, and then there are different contracts, with a stop loss insurance. You have what's called 12/12, which is incurred in 12 months or paid in 12 months, or you have a 12/24. I know I'm kind of getting in the weeds here, but incurred in the first 12 months, paid in the full 24 months. So you have different contracts with a stop loss carrier because, as most physical therapy private practices know, when you submit that claim, it's not always paid immediately, or sometimes it takes a while for the claim to be submitted. So you want to make sure that you're covered by that stop loss agreement in case it gets filed at the end of the year and claims are filed like January, February, March. You don't want to be not having coverage and be exposed to those claims. So that's kind of a generality of what the stop loss serves as. And again, we have access to probably more than 50. I know I said 20. That's usually what we try to narrow it down to. But there's a lot of options when it comes to stop loss insurance. And our goal is to buy the least amount of insurance. So as the plan performs, we actually raise that deductible on the specific one individual. It's not the deductible that the employee pays, it's the deductible that the plan has as a risk, a cap. So on a 100 life group, you may have a specific deductible of anywhere from 50,000 or 75,000 per member that's on the plan, and then you have that aggregate umbrella insurance for the rest of the group.
And you already sort of talked about PBMs. So that's a pharmacy benefit manager, how they come into play in terms of thinking creatively about costs. Is that like an accurate, that person's job is to think creatively or think more responsibly about costs?
So maybe people have heard, maybe they haven't. FTC is actually suing a lot of the pharmacy benefit managers. We have three major pharmacy benefit managers that source 80% of all drugs in our country: Express Scripts, CVS, and Optum. And CVS owns Aetna. Optum is owned by United Healthcare, and Express Scripts is owned by Cigna. So those three are all pooled together and they collude and they help each other to make more profit. And so these pharmacy benefit managers, they'll have what are called formularies. They're lists of drugs that are covered or not covered, and they steer people into the different drugs that they get paid higher rebates on. So maybe you've heard of rebates, maybe you haven't, but a rebate is basically just a kickback on higher cost drugs, usually specialty drugs. And so those rebates are paid back to the fully insured plan. They're not paid to the employer. On a self-funded plan, those rebates come back to the plan to help offset future costs. So that's one major difference between an independent pharmacy benefit manager, one that's not owned by one of the large insurance companies, and the three that I talked about. Another thing that they do is these pharmacy benefit managers, the ones that are creative, they're looking for ways to reduce costs. So you may have seen at the end of commercials at night, right? These drug commercials for specialty drugs, Sovaldi, Manjaro, the GLP-1s. They're very popular right now. At the end, they'll say you may qualify for assistance for this drug. Well, what that is these pharmacy benefit managers have found a way to work with these manufacturers to basically find programs where those costs can be reduced both for the member on the plan as well as for the plan sponsor, the employer. So their patients assistance programs, their copay assistance programs, and an independent pharmacy benefit manager will actually look at those drugs, work with the member to see if they qualify for those programs and reduce their overall cost, versus the larger pharmacy benefit managers typically don't offer those services. Some of them are starting to do it more. The other big thing that I talked about was international sourcing. So these independent pharmacy benefit managers will work with third parties to find the drugs that are same manufacturer, same labeling. It's just at a lower cost, shipping it from Canada, New Zealand, United Kingdom. We have some plans that actually get drugs from Mexico. So we look at everything and see what makes the most sense and what the plan sponsor feels comfortable with, and roll out a strategy of communication to the employees to help them with that.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
Just feels like more transparency, more control when you go into anything that's sort of franchised out, right? Something so huge, you're going to have less control. It'll feel like you can save some money, but when you start to do the math, it doesn't really look like that. So it feels like you're just getting this off the shelf thing. So it should cost me less and be better. And we're saying, again, that's sort of inversely proportional. Is the more you pay, the you're not getting the best thing.
That's correct. Yeah. And employers, I think, feel like they're kind of stuck, right? They play this game every year. I played it, where every couple of years they have to switch insurance companies. They get a 10 or a 15%, and we negotiate it down to 7. It's like this game back and forth. And you always ask them, why am I getting an increase? Well, it's due, you have some high claimants and it's due to trend. And a lot of employers just fed up with it. They're like, I'm tired of running on the rat wheel, and I want to do something different. I want to have control and get information that gives me more control.
And this is more of a necessary evil and a necessary annoyance. Like, not many PT practice owners open to practice to think about the third most expensive thing on their line item, which is health insurance for their employees. They want to offer this. They want to create a great culture, a great place to work, and they want to have
Mhm.
motivated employees. And they've got to become an expert in this every time a contract negotiation begins or every time a contract ends and another one begins. And that sucks. But if you're one of these big companies, if you're one of those big three you mentioned, you're just going on math and you knowing what else is being offered. So you're saying, this is my best offer, take it or leave it. Well, now there's these different options. So for business owners listening, we'll talk about real world impact. For the practice owners who are like, okay, either I need to pay attention to this or I've been hit with this. Health insurance costs are a huge line item, as you mentioned. I think you said the third most expensive one, typically.
Second or third,
Whatever,
typically,
two.
yep.
I'm going to guess salaries and overhead. Yeah, and then,
Yep.
and then health insurance. What's one immediate step practice owners can take to start gaining better control over those insurance costs? And then how can your approach that you're talking about make a tangible difference in their bottom line, their P&L statements?
Yeah, this is going to sound like a kind of a strange answer.
Okay.
Get your broker to start looking outside of the BUCAs, the major insurance companies. There's lots of companies that are starting to develop, and even for smaller companies, right? Not just the 100 plus, but there are other companies that are coming to market that can be viable options, right? So one of the things that drives down costs significantly is what's called reference-based pricing. So instead of having a network of doctors like Blue Cross, United, Aetna, or Cigna, you can actually work with one of these. I call them bundled, non, carrier owned solutions, and there are various ones in different states out there now where they can do what's called a level funded plan, where you're still paying a monthly premium into the plan, and then at the end of the year you can look at how your plan has performed. You get limited data. It's better than what you get with the major insurance carriers, but it's still limited. But it's kind of a middle step, right? If you're not ready to go down the full self-funded plan that I've been talking about, there are other options kind of middle of the road called level funded carriers. And there are more and more coming about. I was just at the Rosetta Fest Health Rosetta Conference a few months ago in DC, and there were probably 3 or 4 new ones that I'd never heard of before. So I think that that's something that, smaller groups, it's a solution that they should be looking at. The risk, there is no risk for them versus with a self-funded plan, they take on a little bit more risk on that specific deductible. So that would be just, you have more power than you think you have as a business owner. And you really need to start pushing these advisors and brokers like myself that may not be aware that there are other options out there when there truly are.
Love it. All right. So if someone is out there nodding, number one, how can they get in touch with you? Like, throw out the easiest way: website, email. What would you tell people to call you? How do they get you?
Yeah, the best way to get a hold of me is just send me a text on my cell phone, 480-518-3942. Email is simple, jdharris@mahoneygroup.com. And then my LinkedIn profile, it's Gentry with a J. So I'm the only Gentry Harris out there that I'm aware of.
Smart man. All right. Last thing we do on an episode, we call it the parting shot. What's your last idea, mic drop moment, soapbox statement you want to leave with the audience? What do you got?
Yeah. So like I said before, I think business owners are the sleeping giant when it comes to healthcare. You have more power than you think you have, and don't be afraid to try new things. There are some things out there that can be damaging and not good solutions, but just find an advisor that has experience in self-funding. Ask them pointed questions, ask them for references, look on LinkedIn, talk to other PT, practices that are doing self-funding, and really do some homework, because at the end of the day, it's extremely advantageous. There is a solution to fix healthcare. We've just been told otherwise. And as Jeff Gold, one of the direct primary care doctors, said at a conference that I attended, we are addicted to a system that is broken. And it's time for us to get off of the addiction of health insurance and fully insured plans.
Well said. All right, Gentry, thanks for making this at least palatable, even for someone like me, understanding, like, listen, first of all, if someone takes something away, there's another option. You don't have to just go with these, what'd you call them, BUCAs again? Blue Cross Blue Shield,
yes, BUCAs.
United Healthcare.
Yep.
So there's alternatives. You don't have to. And there's people along the way to help you. to figure that thing out.
Absolutely.
So you don't always have to go with these big giants and the off the shelf things. Gentry, thanks for making this understandable, even digestible for someone like me, man.
Thanks, Jimmy. Appreciate your time, man.